Hello everyone, I'm Lidia Devasia. I'm a speech language pathologist. In this video, I will be talking about echolalia and tips to reduce echolalia in children. Now let us understand what is echolalia. For instance, if you were to ask your child, "How old are you?" and the child repeats, "How old are you?" This is a typical example of echolalia, wherein the child merely repeats or imitates what someone else has said instead of responding to the question. This is mainly seen in children with autism spectrum disorder. Now, let me give you some easy tips that can be employed to reduce echolalia in children. Tip number 1. Work on improving your child's vocabulary skills. If the child is echoing when answering questions, that might be because they don't have strong enough language skills to know what to say instead. Work on whatever skills the child is missing. Echolalia decreases as the child's receptive and expressive language skills increase. Tip number 2. Simplify verbal messages. Use simple, precise language when you are talking with your child. Example, open the box, take pen and give it. Tip number 3. Ask the question and then immediately say the answer with a single word. For example, what is your name? Ruby. Emphasize the name Ruby. Ideally, the child will just imitate the name part of it. If not, encourage the child to imitate her name. Tip number 4. Modeling the correct sentence. If the child comes up to you and says, "Do you want toy?" you could say that, "I don't want toy." Then you should ask the child whether he wants the toy. Then you could encourage the child to say, "I want toy." Tip number 5. Use visual supports. Use of visual supports such as pairing a visual symbol with written words the child can use. Tip number 6. Use visual schedule. Let your child know what is going on and what is going to happen next. This helps to reduce anxiety and stress in your child. When the environment is comfortable, the child comes up with more positive responses. Please do try it out. Definitely you will see the difference. Thank you.